Some mornings start with a deep breath, a moment to prepare for the day ahead. But for millions of women, that moment is overshadowed by a familiar pain, one that lingers, disrupts, and demands to be acknowledged. This isn't just a bad period. This is endometriosis. Endometriosis is a condition where tissue similar to the lining of the uterus, called the endometrium, grows outside the uterus. This tissue can be found on the ovaries, fallopian tubes, and even in areas beyond the reproductive system. But unlike the normal uterine lining that sheds during menstruation, this misplaced tissue has no way to leave the body. It becomes trapped, causing inflammation, scar tissue, and severe pain. The symptoms of endometriosis vary, but they are often dismissed as normal period pain. However, this condition goes beyond that. It can cause intense pelvic pain, heavy or irregular bleeding, pain during or after intercourse, digestive issues, and even infertility. For some, the pain is cyclical, flaring up with each menstrual cycle. For others, it's a constant, unrelenting presence. So, what causes endometriosis? The truth is, no one knows for sure. Several theories exist. One suggests that menstrual blood flows backward through the fallopian tubes into the pelvic cavity, allowing endometrial-like tissue to implant and grow. Another theory points to genetics, where family history increases the risk. Some believe immune system dysfunction or hormonal imbalances play a role, but despite extensive research, the exact cause remains unclear. While any woman of reproductive age can develop endometriosis, certain risk factors make it more likely. These include starting menstruation at an early age, having short menstrual cycles, heavy periods, or a family history of the condition. Environmental factors and high estrogen levels may also contribute. Living with endometriosis isn't easy, but there are ways to manage it. Pain relief often starts with anti-inflammatory medications or hormonal therapy, such as birth control pills or GnRH agonists, which help regulate or even suppress menstrual cycles. In some cases, surgery is necessary to remove endometrial-like tissue, especially when fertility is affected. For those seeking alternative approaches, physical therapy, dietary changes, and stress management can provide relief. One of the most important aspects of managing endometriosis is finding support. Whether through medical professionals, family, or support groups, knowing you're not alone can make all the difference. This condition is real. The pain is real. And the need for awareness and better treatment options has never been greater. If you or someone you know is experiencing symptoms, don't stay silent. Seek help, get informed, and continue the conversation, because every woman deserves to live without unnecessary pain.